We really need to start preparing kids for, what problem do you want to solve versus what is it that you want to be.
From Offscript Media, I am Matthew Zachary, and this is Out of Patience. On the show today, another take on the big question of, can science speak person? With the incredible Bridget Chapital, founder and director of, and I just love saying this name, Hypothesis Haven Science Club. Just saying that makes me feel smarter. HHSC, as it's known because of acronyms, is a next-gen educational program for kids aged 5 to 13 that inspires more critical thinking in our youth, something I think we could use with our adults these days, but I digress. Seeing as how the odds are definitely stacked against the average person being able to navigate the healthcare system process, Bridget's background in health science and clinical research make her the perfect person to apply the lessons she's learned from children and translate them into startup culture and the healthcare system writ large, especially in the world of trials. Answering the age-old question that I started at the top, can science speak person? I'd like to believe so, and maybe we'll learn if that's possible today. Are you smarter than a fifth grader? Let's find out. Enjoy the show. Bridget, thank you so much for coming on Out of Patience. It's been a long time coming. I got to know you very recently, and we have so much in common and so much to talk about. But I first want to level set the conversation by, let's bitch a bit about COVID and back to school, because you have 3 and I have 2. And are you a red, white, or rosé kind of girl?
Actually, neither. I am more of a vodka drinker, but I recently had to stop that. But it really hasn't been that bad for us because we are in a suburb of Houston, so there's lots of different school districts around here. We initially were supposed to start August 17th. Probably the week before that, we found out it would be pushed back to August the 24th. And then from there, they decided that they would start online instead of in person. And so, as you know, Houston was a bit of a hot spot for COVID. I think sometimes it does kind of get lumped in. I mean, Texas is a huge state and people just say, Texas is so bad. But people have been really responsible for the most part here in town. And so the rates are decreasing. And 2 of our kids were actually able to go back to school face to face probably a couple of weeks ago. But we still have 1 that is in a school that decided to hold off until mid-October, which is where the majority of schools in this area are probably going back. So, I'm not going to lie, the online piece was really difficult because I have a kindergartner, 3rd grader, and 5th grader. So my girls are the older 2, and they were pretty decent. My 10-year-old, I heard her teacher telling her, "You've been late to class 3 times." And I'm like, at the dining table, I don't understand how did this happen? So, she had to take the headphones off so I can hear what's going on. My 3rd grader is very responsible, so she was able to keep up with her classes. But my kindergartner, it was just torture. I mean, we're bringing him back to the iPad like several times a day, several times an hour. And I think where it went wrong is the teacher taught him how to turn off the camera in Zoom. And so I just don't understand why that had to be, why did you teach them that? Because now you're texting me like he's turned his camera off. He's not.
Yeah, right.
It's like
Bad
he didn't
idea.
know how to do that until you taught him, and so it was kind of tough. And I think that if for some reason schools do close down again, the girls can probably continue with the online, but my son will probably just pull him and do like a traditional homeschool model and not really stick with what the district is offering. But other than that, it's been okay. Every morning the 2 that go face to face, we do, the temperature checks. We have to fill out an app that tells the school how they're doing. They wear masks. They have kind of modified class sizes. And so far it seems to be going okay. What about you?
Yeah, as of this taping, you're way more well off than we are here in New York City.
Oh, really?
And this is the 3rd week in a row they've continued to delay the hybrid back to school model. And depending on when the show airs, we may still be hybrid here in New York with 1.1 million kids. And it's only chaos. And my wife's a teacher, and they were told, you still have to go into the school. And we promise it's clean. So what happens the day she shows up in the school? It's a shit sty. So, like, thank you for that level of appreciation for the health and wellness of our teachers here in New York
Oh,
City.
wow.
So, anyway, I digress because, like, it's just we need our venting sessions. I'm more of a bourbon guy than a vodka guy. My dad's the vodka guy, but I completely appreciate that is your potable of choice.
Yeah, I just kind of feel like, there's only so many glasses of wine I can drink that just the vodka just gets it.
But I mean, speaking of children, I was really enthralled to meet you. I think it was through TJ. Is that how we initially met?
Was it on, I think it was on LinkedIn. So
Oh,
probably commenting on somebody's oh yes,
right.
actually, yes. Yeah. I think I ran into TJ's profile and then I commented on some things there. Yes.
And then the mutual stalking began. And I'm enamored with your work because, for what you do, I was it's there's such I mean, we're going to get into it, but what inspired me the most about what you do is, and I'm just going to read this verbatim because I make things too complicated, is you're the founder and director of Hypothesis Haven Science Club, which sounds super cool without a description, but it's an educational program for kids that explores life science careers and teaches the steps that scientists take to discover, prevent, and treat illness. Now, that sounds like something for college, and yet you've mastered this incredible program for children between 5 and 13. And I feel like we're going to get into what that looks like and how it works, but there are people in their 40s that need this. So,
Oh, right.
so what drove you into this level of pediatric pedagogy in science?
So in college, I majored in health science. And so basically, whenever I tell people that, they're always like, okay, what the heck is that? Like, what were you trying to do with that? And the honest answer is probably I really did not know at the time. I knew that I really liked science. I didn't necessarily know what that would look like. I am first generation Nigerian. So of course, you can only be like a doctor, a nurse, an engineer, a lawyer. These are sort of the careers that are acceptable. And so, I didn't necessarily know that I wanted to be a physician, but I did know that I wanted to be, medicine adjacent or somewhere in that field. So after graduating college, I moved to Houston, and Houston is sort of like the mecca, basically, of the medical. That we have the Texas Medical Center here. It's a really big medical campus, and so I just figured if there's something that I can do in the medical field, I can do it in Houston. Kind of almost like if you can make it here,
Right, right.
or like the New York of Texas, right? So
Yep. Well
so I
done.
moved here, and and I sort of just fortunately fell into the clinical research world. It's not anything that I even knew about while I was in school, but it was a field, and specifically oncology research. It was a field that really felt natural to me. I really took to it. I learned so much. It was extremely fascinating. And then I just kind of continued my career throughout that. And it came to a certain point where, sort of my roots and my really wanting to be a resource that helps people to understand this process and understand this new world that I had discovered, but that really wasn't getting as much, I guess, attention. I mean, right now, I think it's really commonplace to turn on the news and we're talking about the FDA and clinical trials and, vaccine trials and phase 1, phase 2, all these different terms that are pretty familiar now. But back then, and even probably maybe 10 months ago, those weren't really like common terms that the public was really aware of. And so it sort of became my goal to sort of mentor high school and college students about the field, go back to my college and, tell other people that were like me and not really know what they wanted to do with their medical-ish background, that there's actually, a whole industry out here that you can be a part of. And so, I ended up going back and getting a master's in health education. And I naturally just thought that there would be some opportunity where my clinical research background and my health education focus would naturally come together. And, that just actually never really happened. And so, I just kind of kept on that same path, climbing the career ladder. And at a certain point, I was like, you know what? If this is going to happen, it hasn't happened naturally. I need to make it happen. And so, with that, I kind of looked at how there was a lot of programs out there for, high school students, college students to sort of learn about basic science and the whole like drug and device development process. But there really wasn't a space like that for children. And this was sort of the early, well, maybe like the mid 2000s where STEM started to become like this huge buzzword. And you have kids, so you probably,
Yep.
it's
Stem this, stem that. Yeah.
exactly. It's going to make them just like the most wonderful person in the universe if they,
The cure to intelligence is STEM. Yes.
Exactly. And so, but as a parent and a medical professional, when I was looking for programs for my children, I was just noticing like these very diluted programs that would teach kids, to follow the steps to make volcanoes or slime or, things like that. But they were really focusing on helping kids to become scientific minded. And, I think that if you would ask a kid, what does a scientist look like? They're thinking of like this, crazy guy with glasses in the lab making potions. And
Right.
that was not anything at all like what the scientists that I worked with every day were like. And so from there, we decided to start Hypothesis Haven Science Club. And it's more of a health science program that provides just exposure, like you said, to life science careers. And we're really teaching them the steps that scientists are taking as they're discovering and treating and curing different illnesses.
Just the idea of creating almost like questioning everything when you're already a wild-eyed, curious child beyond the, I would say, the realm or the shackles of the school system is always so necessary. My daughters learn more about the Kuiper Belt from YouTube than anything at school could have taught her. So there's such an intrigue here. Again, as a father of 10-year-olds that are very curious and looking for things beyond the school, the extramural stuff. STEM is an acronym that means whatever it means to your district. But you're creating this expanded Marvel Cinematic Universe, literally a universe, to inspire that idea of, I think the word you use, innovative thinkers, right? Kids are already naturally incubating as innovative thinkers, but how do you galvanize and capture that? So you've been doing this a while. What's your experience been like? What have you seen tangibly? Are we creating the next generation of not maybe Rick and Morty Doc Browns, but actual scientists?
Well, so the thing about it too is that we think about ourselves as health science ambassadors, but really, the future is going to need scientists, going to need engineers, problem solvers, innovators of all stripes, right? So, our programs just try to set in place that innovation mindset and scientific thinking skills that are necessary to solve any of the world's problems, not necessarily just in medicine. So these are transferable skills. Once you can take the steps to like identify a problem, ask a question, form a hypothesis, kind of go through those steps, test it. It's a scientific method, yes, but these are steps actually that you could use, for any process or across any industry. So, that's sort of the lane that we're in. But, we do this by having these really fun, live, interactive workshops where we're, really just trying to solve medical mysteries and, help kids, really kind of learn how to think versus what to think, which I think is a lot of what they're usually taught in schools. You have to learn this, you have to learn that, you got to pass this standardized test. And so, really trying to help them think outside of the box, but in a way that, really kind of builds on some of the subjects that they're also, already learning in schools.
So let me ask you a basic question. I know actually basic these days is a bad word to use, but I'm going to use it anyway and just channel my inner Gen Xer, and I'm sorry about that. But what does innovation actually mean to you?
Well, that is a good question. So basically, innovation to us just means really thinking in terms of the present and future and not so much thinking about the past. I think that when you are talking to kids and really trying to come up with things, we kind of fall into the habit of asking them questions like, well, what do you want to be when you grow up? And things like that. But in actuality, there is a huge mismatch between young people's ideas of what they're going to do when they grow up or what the labor market or what jobs are going to be like when they grow up and the actual realities. There's so much automation going on and new technologies that are coming online. But I believe there was a study that high school students that they asked in the year 2017 still wanted to do this sort of dream jobs that high school students back in like the early 2000s were saying would be their dream job. And if nothing else, like an Instagram influencer wasn't even,
right,
a thing in the early 2000s, but, they still pick very traditional jobs. And it's a situation where we really need to start preparing kids for, what problem do you want to solve versus what is it that you want to be? There's a scary list of like the top 10 global threats that there are right now. And the funny thing is coronavirus really actually isn't quite on that list, which is sort of scary. But, climate change, food insecurity. There are all these sorts of problems that have been around for a very long time. And, if we're going to be able to solve those problems, we're really going to need to start training children to think and to respond in different ways than we have before. And so to me, that's, what being able to be an innovative thinker is, to kind of think outside the box and come up with ideas that have not been thought of before, and not just continue to do things because that's what we've always done.
Back with our guest after the break.
Has your chronic illness made it difficult to continue working in the traditional way? Want to learn how to find and create flexible remote work that both accommodates your chronic illness and generates an income? Join the Patients Getting Paid membership, a community of chronicpreneurs where people just like you find workshops and trainings, weekly updated condition-specific gigs, twice monthly coaching calls, co-workings, accountability, and the kindest community to support you on your path to make money while working from anywhere and taking good care of yourself. Learn more or join us at patientsgettingpaid.com.
Picking up on what you said just before, I had asked my son, not my daughter and her Kuiper Belt wisdom, what do you want to be when you grow up? And he said, a YouTuber. And I said, no.
Oh, wow.
You're not. And I want to just go back to, like, remember The Far Side, that cartoon by Gary Larson in the 80s and 90s? It was like the most, Google it, kids.
Okay.
But there was one cartoon.
Oh, I do. Yes. It had the random, like, ironic. Yes.
Yeah, it was awesome and sardonic and perfect and unique.
Yes.
And there was one that was out where it was a parent reading a newspaper want-ad section with his kid in the background playing like Space Invaders on an Atari or whatever. And the want-ad said, looking for kids who can get 1,000,000 points in Space Invaders, highly paid job. And it's like any parent's nightmare is a job. Come be a YouTuber and make all the money you want.
Exactly.
But I love that you said before, what problem do you want to try and solve? And it's not what ore to use in Minecraft. I want to channel our conversation we had on the phone like 2 or 3 weeks ago, where we talk about, all these syllables and all these words and trials and whatnot. And in adult land, where you can't possibly have all of this academic wisdom at your beck and call, who translates that down to make sure you know what's happening to you and answer the age-old question that keeps coming up on my show: can science speak person?
Right. Well, so, right now there is such an absence of science information that regular everyday people can access. And, that's one of the reasons why we're seeing so much misinformation and confusion, about the coronavirus. And, it stems from the fact that, so I come from a world, so in academia, where our audience is other scientists, other medical professionals. Our work is being published in protocols and journals. And that's sort of our audience that we're going to explain new discoveries. And there was a colleague of mine that, gave a talk where she mentioned that by the time that your average MD or your average scientist has finished their education, they have learned basically the equivalent of a whole new different language. So all these terms, all the jargon, it's basically like medicalese. And so when they bring that and they try to communicate with just average person, it's kind of the equivalent of, they're over here speaking French and we speak English. Like there's a disconnect. And so it's really important to build bridges of understanding between the scientific community and the public. But so how do you do that? Well, number one, they need to sort of understand how the public takes in information. It's funny, like my oldest, my 10-year-old, she's sort of reminds me when you're describing your daughter, she's one of these kids that, like Encyclopedia Brown, she's like the Black female version of that.
Oh my God. That's the best throwback.
Yeah, so the little girl version of that. And so, she can just spit out any sort of fact about anything. Like we went to the Arboretum with some friends the other day, and so my friend was there with her kids, and she mentioned something about a bird, and then, my daughter is giving like the genus and the species and this and that, and it's like she's just spitting out all these facts. Kind of not even we weren't even asking for these facts. And so one of the things that we try to work on with her is before people care how much you know, they need to know how much you care. And it's sort of, kind of like a cliche thing, but it's really true. And I think it applies to scientists. It's not enough just to come out, with your degrees and your, sort of alphabet soup behind your name and say, I've studied this and this is why it's important, right? So when you're dealing with the public, you really have to let them know that you care before they can even get in the right headspace to engage with what it is that you're trying to say. And so that's why I think that people have really resonated with people like a Tony Fauci, that kind of has that New Yorker kind of grandfatherly, that gruff voice that's real recognizable, and he's just coming straight out with this information that you pay attention to. And then another good person that I've seen is Peter Hotez. I think that I talked with you about that. He's sitting here in this office with this bow tie, looking very professional, but then he's like hitting the panic button pretty much like in every single
Yeah,
and so it's
exactly.
kind of like it catches your attention. And so I think when you see people that really have a personal stake in what they're saying, that resonates. But for the rest of scientists that, sort of are behind the bench or they're in the lab, I think it's a matter of whether you're talking about terms, whether you call it health communication, public health, science communication, health education, like whatever you want to call it. We really need to take a cue from marketing professionals and really know how to tell a story and how to really kind of package this information in ways that resonate with people. It also depends on who the messenger is. If you're trying to reach certain communities, you might want to find people, scientists who are in those communities that really know how to talk the talk and really make those connections with people. But, I really think it comes back to just a different way of thinking about how scientists are going to engage with different audiences. It's not enough just to sit back and publish your journals and do your work, and let that be sort of the kind of marker of whether you're successful in your career, but really being able to make a difference and make an impact on an everyday level, especially with something as impactful as the coronavirus that's affecting so many people. It really would be, I think, just a no-brainer to have different scientists from within that community really kind of step forward and be more visible and really just sort of share exactly what it is they're doing, so that the public can know about it, and also just to get that trust of the public so that they can feel more comfortable and do the things that we need people to do in order to sort of get this situation under control.
I read a horrible article statistic today, and that I'll reference it in the episode description, that 90% of the children who've died from coronavirus were in Black and brown communities. And that is, there is no acceptable death of children under any circumstances, but that is egregiously exposing the ebb tide of how income inequality and outcomes and disparities gravely affect whatever happens to you. And this isn't a patient story. This is just an American citizen story channeling what you said. Who's the messenger? We say social determinants of health, right? That's our jargon, SDOH,
Right.
right? A determinant of health should not be your skin color. And this is something that may or may not be preventable, and messaging and who's delivering that to the communities. Do you have any good news anecdotes about better or successful messaging to communities that may not be as receptive as others to scientific messaging?
I think what it really boils down to is just being able to gain that trust. So I know that there are, a few efforts out there, not nearly enough, and especially like here in Houston, where we have such a prominent, medical center. I feel like there's not really that many efforts being made. But back to your question of who could be the messenger. I mean, there are certain scientists frontline. I think we talked about like a Kizzmekia Corbett, for example, is somebody that's kind of caught my eye as somebody who is, 30 something, Black woman. She's a lead scientist for the NIH coronavirus task force. And, somebody who kind of speaks my language. I follow her on Twitter. She talks about Beyonce, I mean, everybody, you know what I mean? So people like that. But I think that something that becomes sort of the narrative is that, people in the Black community are fearful because of a Tuskegee. And it's like, well, if you ask the average, 20 something, 30 something, you know, person, Black person about Tuskegee, they don't necessarily know what that is, but they do know that, large institutions, are not necessarily always the most trustworthy. And the medical community, sort of falls under that umbrella. They do know that if you're a sickle cell patient that's in a crisis and you go to the ER, that you're likely to get turned away because they think that you're an addict who's seeking pills. And so it's just these sort of everyday experiences that communities of color have that lead to that distrust. And so I think one of the things that I've been seeing that a lot of people in the health space have been saying is it's racism, not race, versus when we used to say race is like a determinant of this and that. No, it's racism, right? So I think it's the same thing when you talk about those communities being able to engage in clinical research in a way. I mean, there's just a distrust of any sort of large institution in this country, unfortunately, that you have to depend on. And we don't leave our family members typically in the hospital alone. And so you see a lot of that with COVID, where the hospitals are closing down and you can't visit your family members. I mean, there's just a lot of distrust there that will take a lot of intentional efforts to break. And I don't necessarily know that there's one person that could make that change, but there are certainly like community based participatory programs that could sort of make a difference, where you're actually going into the community and using people from the community, whether that's churches, whether that's community centers, just to really, or whether it's just physicians that come from those communities that can make a difference.
I agree with everything you said 100%, because the odds are always stacked against the average person when they have to enter, I would say like the bad things happen to good people story, or the shit happens story. I'll just be honest, and
Yes.
the recurring theme is that when you enter the shit happens story, there's no one there to welcome you and say, it's okay to be here. I'm going to hold your hand and get you there, especially if you're in a rural community or from your zip code determines the level of potential greeter in that store.
Exactly.
I know you're not a virologist, but in the interest of, doubling down on this notion of trust and distrust in that sense, we're in like vaccine land. And just again, as of this taping today, the CDC put out that we're not going to have anything viable of a vaccine until at least a year from now. And then on the other side, we're hearing, it'll be out in, 3 months or whatever. But in terms of adoptability and trust, do you have a sort of a quick retort on where you think that is going to land in the ears of the average American?
Well, I mean, I think that there's such a big push against vaccines, and there's, it's just really unfortunate that it's become, even before the coronavirus, just the whole vaccine thing is just kind of like a hot button issue that boggles my mind that it's even a thing. But one thing I do know is that if we are going to be able to get people to take a vaccine when it does become available, we do need to gain that trust back, and we're already kind of, behind the 8 ball on it, because just in regular times, people don't necessarily want to take a vaccine. And so now we're really wanting to push it. And then when you look at kind of the climate and how it's been politicized, that kind of gives people even more pause. But, ultimately, I think just returning to the science, which is something that, is really kind of on the forefront when we are dealing with programs with Hypothesis Haven. We're just going back to the science. It's all about how you frame things. If we're explaining something, complicated to children, for example, you want to give it to them in a plain, matter-of-fact way. There's different resources that are out there, but really just kind of framing the information in the way that you want people to interpret it. But it is going to take, credible sources. It's going to take, real scientists and real people that are involved in the research. I saw this morning, there was a physician, a Black woman that actually volunteered for COVID trials and had done kind of an interview tour where she was just talking about it and her reasons. Her father had died from coronavirus, and he was a research scientist. And, just really kind of humanizing it and personalizing it, I think, makes the biggest impact, because we're really sort of trying to wage this battle of public opinion almost, when really, science is true whether you believe it or not. And so, I think it is going to take sort of looking into those different avenues of really trying to craft the message. Whoever came up with like flatten the curve, I think was just a genius. Whoever came up, when we were kids, and that, this is your brain on drugs, like with the frying pan and the eggs, like something like that just really helps to sort of really crystallize in people's minds, exactly like what's at stake here and what needs to be done.
I got to tell you, this is like my brain hurts just because like I like to be the dumbest guy in the room when I have great conversations with people, and this is no exception to that rule. Although I do want to say that this is the first time ever on any show I've ever done where we brought up Encyclopedia Leroy Brown. So kudos to you for that epic
Funny.
80s childhood throwback. Bridget Chapital is the founder and director of Hypothesis Haven Science Club, proving that you can actually make science talk person, and children are the best example of how to make that work in grown-ups. Thank you so much for coming on Out of Patience.
Thank you for having me.
That's all for today, folks. If you like the show, be sure to subscribe, leave a review, follow us on social, and tell all your friends to listen. Out of Patience with Matthew Zachary is a product of Offscript Media. Our executive producer is Matthew Zachary. Our senior producers are Jen Horangeff and Andrew McDowell. Darren Tunn is our production intern. It is recorded, mixed, and edited by Matthew Zachary. Our theme music is by the Mike Van Allen Quintet and by Mara. For advertising and media inquiries, email media@offscript.com. Hit us up at contact@offscript.com to share comments, feedback, and make guest recommendations. For more information, visit offscript.com.